We do testosterone replacement here for men. There are supplements that we can actually give. And guess what? You know what's great about being a PA?
Girl, tell me.
I can actually write prescriptions. Did you know that?
Yes. Tell us more.
Well, I don't think they even realize I'm a provider sometimes.
I know.
It's like, hey, girl, you got my tox. We're good to go.
A provider, nonetheless, who has a ton of experience.
Did you know I could order and interpret labs as well? So we actually do that here too. I do that here too. I guess it's going to be like a little bit of show and tell for you guys too, because I do have my lovely V30 here. What I could do with my V30 for women is actually, I hate saying minimally invasive. Honestly, it's really more so of a non-invasive vaginal rejuvenation and labial rejuvenation that we can actually do with our radio frequency on our device.
I'm curious, because maybe from an outside perspective, what can people expect an improvement of when they do this type of treatment?
You can expect after a series of treatment, of course, some women suffer from labial laxity from getting older and from childbirth, and they want to feel confident in that again. Like they kind of want it to look prettier.
Yeah,
again.
Absolutely.
They're restorative treatments. You can expect an improvement in vaginal lubrication, vaginal tightness, better orgasms. Oh yes, I said it.
She said it.
Better orgasms. So why sit there and suffer through it when there is all of the technology that can actually help you that no one talks about? I'm just going to show you what technology we have here. It's our VVR tip. This is used in vaginal restoration. Nothing intimidating. Looks like a curling iron piece. Nothing huge.
I was gonna say, it looks like a curling iron.
Extremely comfortable. We require up to 3 treatments actually to get a full benefit, but you do see a benefit after 1 treatment. So this is for vaginal restoration. This handpiece is also radio frequency. Feels like a gentle massage, honestly. So what it does is it actually creates thermal injury to just signal the body to repair itself and build its own collagen and heal itself and repair itself. And that's actually what the VVR tip does also. These 2 hand pieces create thermal injury. Doesn't hurt, just a fancy word that means that which are causing changes in the tissue to signal the body to produce collagen and to repair itself. We're really heavily focused into restorative treatments here at Suvita. Regenerative medicine, which means that with these treatments, you could actually heal yourself. We do a lot of platelet-rich fibrin, which we can also inject into the genital area to help increase blood flow, improve appearance of male genitalia, increases girth. PRF injections or P shots do increase male girth, which some of you may think is great. Who would think that was great?
I mean, you said it.
I said it.
So Jen, I have a question. Besides the P-shot helping with girth, what else would it help with for a guy's perspective? Like if he wanted to ask, like, okay, what else does it do besides help with girth if you get a penile?
That's a really good question. I guess I did forget to explain that.
That's okay. I'm asking for
It's just so much information. No, but thank you. That's why you're here.
Yeah.
It's this way, 2 great minds actually don't think alike. We have different perspectives. Yeah. Actually, injecting platelet-rich fibrin into that area could actually repair it in a sense that it improves vascularization, which means stronger and firmer erections.
Okay.
And increased sensitivity, which would mean better orgasms.
So it helps for the man too, which is really nice. I know you were saying with the vaginal rejuvenation, it will help with that. So it's almost like a win-win on both ends.
There are multiple treatment modalities that we have here that can help you, that routine GYNs don't necessarily use as treatment, that are non-surgical, that do work.
And I think from my perspective, I'm not a provider, a lot of us maybe wouldn't ask these questions or even know these things exist because it is more aesthetic, right? But at the same time, you know, if we want to feel better, especially during sexual intercourse.
You hit your sexual prime and then bam, you punked.
I mean, it does. It doesn't sound fun. So why not? Why not help yourself?
It is so unfair, right?
It's not fair, but it's not the end either.
As long as there's communication in the bedroom, because let's face it, if it's very one-sided, it's just going to suck completely.
I agree. Yeah.
Like you have to communicate. If you're not communicating and it's totally one-sided, chances are it's not going to work.
I agree. Talk about sex, baby. Let's talk about you and me. What I say is come talk to us. We obviously are opening up the conversation. Really talk to Jen more because I'm only going to tell you from my fun standpoint, but she's going to tell you from a medical standpoint that this is totally normal. You have no reason that we can't discuss this. Come here, make the consult.
And we can help you. And if we
Yeah.
help you, you for sure will be satisfied.
You will. We're here for you. Let's just normalize it. Stop making it so taboo. Everyone has sex. It's totally okay.
And here we are talking about it.
And here we are, bringing it to the platform. Thank you so much for listening to us. And like we said, we are always here if you have any questions or just need to talk to someone about it, right?
And none of this is medical advice. If you're having an issue, please seek out medical attention from your provider. Or if you're curious about our treatments here, schedule a consultation. We'll see you at the spa.
And come see us. Bye.